Welcome to another episode of the Sankofa Cultural Collective series by the Barbados High Commission here in the beautiful Ghana. And today on this episode, we have a truly amazing guest who has the gifts of the hands. Ladies and gentlemen, I'd like to welcome Dr. Aamir Morris. Hi, Dr. Aamir. Is it Amir or Amir?
Amir.
Amir, please forgive me. Dr. Aamir Morris, welcome to our podcast. Are you happy to be here?
I'm grateful to be here. Thank you.
So we have a very good relationship with you here at the Barbados High Commission. Yeah, definitely. We feel like you're part of us, even though you're leaving. You're leaving us. We have loved having you here in Ghana. But before we delve into that, can you tell our viewers a little bit more about yourself?
Well, first of all, it is the
Oh, it's the same. Very good. Mihoye. Very good.
I picked up a little bit of tree while I was there. But initially, I came here as part of my general surgery training. This is my elective year. I had a strong motivation to do my training for that elective component outside of the Caribbean.
Right. So before we even get into that, I'm sure some of our viewers are wondering, what is he talking about? This is his elective year. He wanted to study outside of the Caribbean. So let's go back. What are you studying?
So I'm a general surgery resident, essentially specializing in general surgery.
Fantastic. So for those of us who didn't go to medical school, he's a surgeon. He's a doctor. He's amazing. Perfect. What made you decide to study medicine though, and actually become a doctor and then a surgeon?
I think the biggest catalyst for that was probably my eldest sister, Rojal.
Okay, so she motivated you to study medicine in what way?
More ways than one. I think her journey, especially being primarily a UE grad, and being able to extend her training outside of the region, just watching her trajectory is something that was a strong motivator for me.
I love that. You mentioned UE, so that's the University of West Indies, which I'm guessing she went to because you mentioned it, and you also are at. So tell us a little bit more. Why did you choose UE, and more specifically, why did you choose to do medicine at UE?
Well, beyond my sister being a catalyst for that decision, I think university graduates in general tend to foster and develop very strong clinical acumen, having to function in very resource limited settings. I think it actually helps us to focus more on utilizing a lot of the intrinsic skills that we develop as medical interns and as medical students in terms of arriving at a patient diagnosis.
Okay, and does it help that UE has multiple campuses across the Caribbean, or that's just an extra bonus?
No, it's definitely an extra bonus. It's almost like a melting pot. Being able to experience training in Trinidad versus training in Mona versus Keyville.
Okay, excellent.
So how did you go from, I guess, choosing to study medicine at UE and then finding yourself in the army, but then also finding yourself on the shores of Ghana? Like, how can you please kind of explain that trajectory to us and how, your previous experiences, I guess, contributed to your decisions later on?
Okay, so starting off with the Army component. So the Army has been extremely pivotal in terms of my medical development and entering medicine as a career. I actually came through what we call the Officer Cadet Scholarship Program, which was a scholarship program which was primarily aimed at developing infantry and naval officers.
Okay.
But in my very unique instance, I had the opportunity to become a medical officer through the OCUS program. And I guess the rest is history from there.
So in terms of carving your own medical journey, how did Ghana fall into that, and how were you even allowed from UE or even the Army to come and spend time in Ghana?
So I think a lot of that is just the initiative and the creativity of the graduate. So during the fourth year of training, graduates have the option to do some form of elective specialization outside of the hospital they're working in.
Okay.
So we may do it in the other UE campuses in Trinidad, or you may do it overseas in the US. I thought, being in the Army, I thought a military hospital would have been a great incentive to at least expand my military training, at least bring something that is more close to home in the sense to the Army. As you know, Ghana exports a significant amount of nurses to help us with our nursing shortage right now in Barbados. So I was having a conversation with one of the Ghanaian nurses, and we kind of exchanged the fact that I was a military officer as well. He explained to me that Ghana has a military hospital. What they came to know is 37 military. So So I try to incorporate that in a way into my elective training and to see where that opportunity would take me.
Okay, excellent. So, how long have you been in Ghana? And tell us the good, the bad, and the ugly for you in terms of, I guess, living and working here, especially within the medical field.
About 4 months doing my elective here. Initially, I would have started off at 37 military, and then I slowly transitioned also into the University of Ghana Medical Center.
Mm-hmm.
Which interestingly enough, the University of West Indies has like a MOU with UGMC.
Okay.
So it was quite interesting. So initially that MOU was extended to just the medical students, but in my scenario, I was able to get them to extend it to resident training. So it was actually connected with the surgery consultants here in Ghana,
Oh,
and they
wow.
allowed me to be part of the team. And from day one, it felt very welcome. It felt like family, and I was able to operate just outside of the operating theater. They exposed me a lot to some endoscopic training, so I was able to do upper GI endoscopy, colonoscopies, and I feel like um, these are resources that we need to develop more so in Barbados as well.
So these were your first. This was basically your first experience doing those types of surgeries.
Oh yeah, my first experience getting to do endoscopies and colonoscopies. Yeah.
But when we talk about the style of training and I guess the style of working,
Mhm.
comparing Barbados and Ghana within the medical field, what would you say are the similarities and what are the differences?
I think in general, most residency programs are quite militant, very intense. So it follows a similar trend in terms of having very long hours, sleepless nights. The graduates having to be very committed, a lot of sacrifice from the ends of family and stuff like that. But beyond that, in terms of the cultures, I think Ghanaians and Barbadians are quite similar. It's very interesting in terms of a lot of the mannerisms. They're very non-confrontational people.
Mm-hmm.
It's a very
True.
interesting society to be part of.
Okay, so you talk about us being similar. Of course, we know that we have a shared history.
Mhm.
We know that a lot of Barbadians can trace some, if not all, of their ancestry back to modern day Ghana. So, Dr. Morris, you've landed in Ghana. You are very tall as well.
Yeah.
You are tall. And we know for the most part, Ghanaian men aren't the tallest
Yeah.
for the most part. So, how was that? How did people kind of I guess their first reaction to you, especially when they would see you,
Mhm.
standing.
Yeah, in general, yeah, Ghanaian individuals, they don't have very tall stature. But it was a lot, even in one instance, I think one consultant asked me was part from the northern part of Ghana.
Mm-hmm.
And I explained not even from Ghana, because even the facial similarities tend to be very quite alike. But no, it was welcoming. Yeah, it was very welcoming. Yeah.
Welcoming in what sense?
And you see people that look like you, not just from a skin tone perspective, but the facial structure is quite similar, similar smells, similar eyes. Yeah. Mhm.
I like that. I like that. Okay. So excellent. So Amir, it sounds like I feel like I'm not saying I keep on saying Amir, it's the British in me.
Mhm.
Amir, sorry. I feel like you've had a lot of firsts
Mhm.
in Ghana. And as somebody who moved back here, I know that coming here for the first time, especially that first week, if not that first month, can be hectic from getting your SIM card, getting your
Oh my
internet,
God. Yeah.
so, right? Making sure people aren't overcharging you. So, how were you able to kind of settle in so seamlessly?
Mhm. So going back to my experience in terms of my military training, I remember when I did my first officers course with the army. We had like these special liaison officers who would take us around, help us get our bank accounts and everything set up.
Mm-hmm.
The Barbados High Commission was almost like that liaison officer
Oh,
for me.
wow. Okay.
Mhm. So
You're welcome.
so yeah, so definitely. So the ambassador, as well as yourself, were very pivotal in terms of getting my housing started out, helping me see, understanding the movement around the place, taking the different Ubers, the boats, understanding where to eat, where to hang out, even like outside the hospital, understanding nice socializing spots. Because medicine in itself is very taxing.
Mm-hmm.
And I don't even consider them like an extended family. It's almost like having a nuclear family here. It's always good to have familiar faces, and having like Barbadians here who were able to help me out with that process was amazing. It was amazing. Yeah.
So essentially, it sounds like even if the landing wasn't the softest,
Yeah.
it was made much softer with the support
Yeah, definitely.
you
Yeah.
received here. So I don't know if you're aware, but one of the mandates here at the Barbados High Commission is to promote the cross-cultural educational opportunities. So what do you think about the High Commission even focusing on something like that?
Oh, I think it's pivotal, and even in the sense of the UE UGMC MOU. So, I'm very proud to be a UE graduate and also to be enrolled in a UE residency program. But the mere fact that we have links here, I think it ultimately makes the candidate a lot more rounded, being able to obtain skills from different hospitals and different universities. Yeah.
So with the medical program and even outside of the medical program, going back to Barbados, what's some of the, I guess, the advice you'd give to some undergraduate, postgraduate students about not only ensuring they do an elective, but considering an elective in Ghana or even any other African country? And then on the flip side, you've been here with Ghanaians who I'm sure have asked you multiple questions about Barbados, studying in Barbados, living in Barbados. What encouragement would you also give them to think about studying in UE or even any institution back home?
To be honest, I think anyone needs to expand their horizons when it comes to any professional journey or exodus that you might be on. Particularly in the sense of reaching out to some places as far as Africa. I remember when the opportunity first presented itself, I went to one of my mentors, Dr. Saleh Griffith, and he expounded upon his experiences here. He said Africa is so vast. I think it's very undersold in terms of the image that Western media puts. And it was amazing going to a hospital at UGMC, being so modern. But at the same time, it put a lot of things in perspective for me. So I think like when I was at 37 military, being able to experience seeing patients in the trauma bay, and in Ghana, you guys focus on the national healthcare scheme, and where if certain procedures aren't covered by that scheme, the patients might not be admitted to the hospital. So that's a huge difference in terms of what we observe back home, where healthcare is free. So I think we take a lot for granted in terms of what services we're able to get back home in the Caribbean. Understanding that you come to Africa is cash and carry.
Cash, literally, I haven't thought about it like that, but cash and carry, literally, literally.
This is more of a personal thing. How do you think this experience, being able to spend 1/3 of a year in Ghana, has impacted you?
I think I developed a lot of not just hard skills and being able to increase my my technical proficiencies, whether it's in the operating room in endoscopy. I learned a lot of soft skills as well. I think Ghanaians are very not just being non-confrontational, but very friendly. I think there's always a huge sense of family. I felt that a lot in the endoscopy unit, in the operating theater, even in the clinics. I think a lot of those soft skills, coming out, hopefully from being a surgeon at the end of my training, I think that would help in terms of my rapport with patients in general. Because surgeons generally tend to be very hard-nosed individuals. Yeah.
Really?
Yeah, very, very stubborn. Yeah.
Okay, well, I noticed on your wrist you've got the Kwabna
Oh yeah.
bead bracelet. So I'm sure you've definitely done some
very,
tourist
very
things.
immersed in the culture. Yeah.
Very much so, and again, we did speak briefly about some Barbadians being able to trace their heritage back. So one of the reasons why we've even called this cultural collective Sankofa is because it literally talks about going back, to your history to essentially know your future. And I think even being able to find out your day name is a privilege that many other Barbadians.
Yeah, I think some of the staff at UGM0, they're so surprised to know that I didn't know like what day was born. That's like something that's very traditional and cultural here.
Oh, so you're saying the staff even in Ghana were like, you don't know your...
Yeah, and that's not something common in Barbados. Absolutely not.
Interesting. So what parts of, I guess, the Barbadian culture were you able to share with your new medical family here in Ghana? And then again, what Ghanaian culture do you feel as though you're going to take back with you to your friends and family?
Well, the operating theater staff, they love clips, so they love soca. We played a lot of music in operating theater, and they love it, man. Outside of that, they were very jovial people as well. So we shared a lot of humor together. Understanding, in a fast-paced, very serious environment, it's always good to, just take the pace down a little bit. just add a little bit perspective to the moment.
Okay, and what will you be taking back?
Oh, I'm still becoming a little. I still acclimatize myself to the Ghanaian food, but I have loved the poto the cocoa. Yeah. So I think it's something I definitely
Really?
try to make when I go back home.
Really?
Yeah, I love cocoa. Yeah.
Okay. But
Mm-hmm.
then, because I know we talk, I mean, I've had it when people have been like, oh, wachi and the rice and peas.
Mm-hmm.
For you, what is so apart from the poto,
Mm-hmm.
you did well though, you did well.
Yeah.
Was there anything you really missed about back home during
Uh,
these few months you've been here?
Home will always be home. I can't say I miss anything in particular because I know I'm going to be going back to that environment. But being in Ghana, my emphasis was not on trying to miss Barbados, was just trying to pick up as much as I could from this experience because I think ultimately it will enrich me as a surgeon and just as an individual from a holistic point of view.
I love that. Okay, so, Dr. Morris, we have had quite a number of Ghanaians actually express
Mm-hmm.
interest not only in visiting
Mm-hmm.
Barbados, but studying at institutions like UE, especially the medical program.
Mm-hmm.
So, for you, if you had to give us, your top three best things about UE and studying in Barbados, what would they be?
First, I think UB graduates are second to none. I think the culture of discipline. I think that's one thing that that's one of my top three points that I would basically allude to. The second thing is the togetherness, the sense of family, the friendships, the bonds that you make whilst training. Because I mean, you're going to school with persons from not just from your country, Barbados, Jamaica, Trinidad, the smaller islands, St. Vincent, Grenada. I think those are friendships that will last a lifetime. So the discipline that you can forge, the family, and I think it gives you, and finally I think a sense of national pride, alluding a lot to one of our previous principals, Professor Sir Beckles. He was huge on regional integration. I think
Okay.
training in Barbados helps you to to harness that sense of just regionalism and nationality and just pride in forging a better Caribbean. I think similarly, that's something that could be easily translated to Ghana and the African country.
Okay. So
Mm-hmm.
that's one.
Mm-hmm.
Also three.
Mm-hmm.
So, what are your next two?
Oh, I counted those as like three.
No, it's one. It's one.
Immigration.
Okay, so you feel like you've given me three. So can you be a bit explicit about the three? So number one,
Oh, so definitely. So I think just harnessing that regionalism and that cultural integration. I think that's very
perfect.
important.
Number
Two,
two,
or discipline. I think Caribbean graduates are extremely disciplined. So you need to be, being able to study and understand that carnival is just a step away,
a stone's
a
throw
stone's throw
away.
away.
And number three,
And thirdly, just I think just the caliber of teaching and the style of teaching. I think just being able to build and develop significant clinical acumen in resource limited settings is extremely important.
okay. Now I know in as much as UE has been impactful in your life, being in the army in the Barbadian army has also molded you. So what impact has that had, especially in conjunction with, being a doctor?
I definitely wouldn't be here without the army. I've had multiple conversations with some of my previous command. I also want to thank the current brigadier, Carlos Lovell, who was fully 100% this opportunity, 100% behind this opportunity. My force medical officer as well. These guys really came together and actually helped motivate me towards taking this very very untraditional career route.
Like, how do you see yourself giving back to both institutions, I guess?
Oh, definitely. I think just to build the surgical capacity of the Army when they return home. Currently, we're working very closely with PAHO in terms of developing the field hospital
Okay.
and just trying to get it up to the level where we can efficiently perform surgeries and deploy to disaster zones and be able to perform surgeries. I think that plugs extremely well into that facet of the army right now. And in general, just being able to take care of soldiers.
I love that. I really like that. Okay, so Dr. Morris, we are coming to the end of our episode, but we're also coming to the end of your time in Ghana. So if you had to sum it up I like the number 3, don't I? If you had to sum it up in 3 words, what would they be?
I think productive was definitely one. The Ghanaians are very hardworking people. I enjoyed being able to plug myself into so many different facets of the hospital here. Secondly, I think it's just a sense of family. I think that's a huge thing here. A sense of family and togetherness. It's very important. And thirdly, is just being able to just step out and try to do something unique. Yeah. So I think the uniqueness of this experience would be the third thing that I would definitely cherish on my return trip back home.
Okay. And will we be seeing you back in Ghana,
Oh,
despite
yeah.
not having a direct flight just yet?
Yeah, definitely. Yeah, especially if there's a direct flight.
Yes, I think that will facilitate a lot of people moving in and out. Okay, Dr. Morris, thank you so much. Now, before we wrap up, I want you to look in your camera and give those back home, young people back home and young people in Ghana, advice about pursuing education and I guess the importance of rebuilding this Atlantic bridge through shared cultural and educational experiences.
So for any person who's trying to build their academic portfolio, I think you need to step outside your natural comfort zones and try to see how you could develop other ways. Don't take the route less traveled in general. And I think the second thing is being able to dispel a lot of the beliefs persons have in terms of the continent of Africa. I think it's extremely vast, not just from knowledge and the people and as well, but I think there's a lot that you can learn from about yourself and in terms of your future career trajectory by coming back to the motherland.
Fantastic. Well, Aamir, it has been so lovely having you, not only for this episode, but having you in Ghana with us. You truly become part of the Barbados High Commission. And on behalf of the entire High Commission, we wish you so well as you return to Barbados and for all of your future ventures.
Thank you so much. Thank you.
You are welcome. And ladies and gentlemen, we will see you on next week's episode.